Hello, everyone. Welcome to this week's edition of Let's Talk Shop. My name is Debbie DiMartini. I'm a certified clinical thermographer with Thermal Body Scan in Santa Cruz. And today, the topic for Let's Talk Shop is fibromyalgia. Fibromyalgia is a disorder that's a bit tricky because it's hard to diagnose. If you or someone you know has fibromyalgia, you're familiar with its myriad of symptoms. And I'm going to talk a little bit about that today. So, first of all, with fibromyalgia, it's thought to be an inflammatory response that's occurring in the central nervous system. The causes are a bit unknown. It's different for individuals. It can be caused by an injury, such as a car accident or traumatic injury of some kind. It can also be caused by illnesses. So somebody who gets a severe illness or a severe infection of some kind, flu or some other type of infection, that can cause fibromyalgia. Women can go through phases where their hormones are changing, which can cause the onset of fibromyalgia. Emotional trauma and stress are also triggers for people who suffer with fibromyalgia. So there's a variety of different things that can cause it, and it's not the same for every person. And it is a little tricky to diagnose because it does not show up in standard imaging modalities. Things like x-rays don't pick up any abnormalities, and neither do blood tests. So it can be very frustrating for the patient that's suffering with fibromyalgia because there's some specific things that characterize the disease or disorder, but it's also tricky to diagnose, which can be frustrating. One of the things that I'll point out about it is that the symptoms generally are muscle pain and soreness, stiffness in the muscles. It lasts typically more than 3 months, and it does affect the upper and lower portions of the body. Poor sleep with morning fatigue and stiffness are also symptoms. Tenderness and specific, what they call trigger points, are also symptoms. Mood issues can also be associated with fibromyalgia. And interestingly, there's a link between people that have fibromyalgia. Half of those people have things like IBS, and there's also a link between fibromyalgia and TMJ, which is disorder in the jaw. So those two things kind of go hand in hand. People with TMJ issues that have fibromyalgia have particularly hard time because it causes a lot more facial pain, neck, and upper back pain, which are associated with fibromyalgia normally. So those people suffering from TMJ tend to have those even worse. Some of the other things that go along with fibromyalgia are depression, anxiety disorders, things like panic attacks, concentration, memory problems. Mitral valve prolapse are also seen more associated with people suffering with fibromyalgia. Fibrocystic breast disease and endometriosis. It's interesting, is it the hormone imbalances that are causing the fibromyalgia symptoms in addition to endometriosis and fibrocystic breast disease? They kind of all go hand in hand. Some of the treatments for fibromyalgia are things like physical therapy. They sometimes give anesthetic injections at those trigger point areas. There's about 18 different points that they will look at if they think that you have fibromyalgia. Stress management. There's always drugs. I always try to caution people to look into other modalities that maybe are a little more homeopathic and safe. Some herbs. Things like acupuncture. Exercise actually is one of the really good things for it because it keeps the fascia tissue and ligaments and joints moving and more limber, so people tend to struggle a little bit less if they can remain active. One of the things that I do point out, and the reason that I bring this up when I'm talking about thermography, is that one of the other things that sometimes gets sort of confused and is sort of in the same ballpark as fibromyalgia is chronic fatigue syndrome. They cause a lot of the same symptoms, generalized pain in the muscles, ligaments, joints in the body. One of the things that's great about thermography is that we can actually determine if you look at this right behind me here, this immune dysfunction, there's a focal hypothermic spot on the T2 vertebrae that will show up with 100% of patients who have chronic fatigue syndrome or fibromyalgia. Now, we can't always identify exactly which disorder or dysfunction you have, but in the event that you think that you may have fibromyalgia and you're trying to find a diagnosis for that, thermography can eliminate that as a possibility in the event that you do not have this T2 focal hypothermic spot. If you don't have that spot, then you don't have it. So it is a way to help diagnose this particular issue, and it affects a lot of people, and it can be very debilitating. So hopefully this was helpful. There are a lot of websites online that give you more information. If you want to find out more, I urge you to do so. I always advocate being your own cheerleading section. Get out there, find out the information for yourself, because again, it affects people in different ways. My name is Debbie DiMartini, certified clinical thermographer with Thermal Body Scan in Santa Cruz. My website is www.thermalsc.com, and we're located in downtown Santa Cruz. Thanks so much. Join me again next week for more Let's Talk Shop.